Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, February 2nd, 2021. Cases continue to trend downward worldwide and here at home. There were just under 4 million, about 3.7 million new cases worldwide, which is about 400,000 fewer cases than there were the week before. First time in a long time we've seen less than 4 million cases a week worldwide. Here in the United States, 1 million new cases. It seems odd to be thinking just 1 million, but that's 200,000 fewer cases than we saw last week. And here in Massachusetts, we saw about 23,000, which is a drop-off of about 13,000 from the week before. So things are steadily decreasing there, but still very high numbers all around. Deaths are still staying even. Worldwide, we saw about 98,000 deaths, which is only about 2,000 fewer than the week before. In the United States, there are 22,000 deaths, which is roughly the same as it was the week before. And here in Massachusetts, we saw 426 new deaths from COVID-19, which is about 70 more than the week before. So the trends more or less continue as they've been, with cases steadily dropping off, hospitalizations falling, and deaths staying more or less even, as we can see here. So while things are dropping significantly, we are still nowhere near where we were at any of the previous peaks. So that is still, beware of that. Even though we are trending very well in the right direction, we are still in a very difficult spot. Looking at the case counts by region, you can see that everywhere is tapering off. The Midwest is the closest at being its pre-surge levels, being where it was in late October at this point. Everywhere else, we're seeing numbers comparable to where they were in November. With the West having a very precipitous drop-off there, the Northeast and the South moving a little bit more slowly on that. But it is important to note that last week was the first week in several months when no state had a single had its highest day of the pandemic for new cases. You can see this chart here. Remember from past updates, as the highs steadily moved rightward along the chart there, but we haven't seen any new highs this past week, which is that's something. At least it's a milestone, unfortunately. Looking at hospitalizations, they're going down pretty much everywhere around the country. The only places with any rising are going to be areas that are already pretty small, like, for example, Vermont there. But almost every state is seeing a decrease in hospitalizations, some of them fairly dramatically. Looking at those regions again, the Midwest is still the most significant there, but the South and West are also going pretty quickly. The Northeast is going a little bit slower there. And now part of that may be because when we look at deaths, we see that the West and the South are also decreasing the slowest in terms of death rates. So some of that hospitalization decrease will unfortunately be due to the ongoing deaths as well. There are fewer people coming in, more people going out, and also still plenty of people dying in those hospitals. Midwest and the Northeast are steadily trending downward. The Northeast not quite as quickly as the Midwest, but at least in that part of the country, things are tapering down. But this is something always important to be aware of, that decreases in one area of the country can easily be compensated for in another area of the country. That leads to the total numbers appearing even. Let's move on to developments. There's a lot of things to talk about this week. First up, I was a little lost in the shuffle with the Johnson & Johnson announcement last week, but we also have preliminary results on another vaccine. This is our fifth there. This is the Novavax vaccine project. This is a vaccine that uses a protein subunit system, which basically takes those spike proteins that are on the outside of the coronavirus and uses those as the system for granting immunity. This is the first we have from the system, so it is nice to have a completely new platform out there, and it showed 89% efficacy. That was in a trial in the UK, where as much as half of the cases that were reported in the placebo group were the more transmissible B117 variant. Unfortunately, its other trial was in South Africa, where the even more transmissible B1351 variant is spreading, and the results were only about 50% efficacy there. That said, it did still prevent hospitalization and death in the groups. So while it will not prevent sickness as well against this new variant, as most of the vaccines seem to be not presenting that as well, they do seem to be still equally good at stopping people from being hospitalized or dying. So if a vaccine can turn the effects of COVID from potentially deadly down to a moderate flu, then that's still a win. Also in the Northeast, the blizzard sweeping in, as just wrapping up, has delayed vaccinations in many states. So we should expect to see the vaccination numbers being a little bit off there for a couple of days as we struggle to make up from the logistical delays coming from a major blizzard. Also, new studies have shown that people who have had COVID previously and recovered, when they get their vaccine, they are likely to have stronger side effects, but also stronger protection. So it's even some people have theorized that people who have recovered from COVID-19 may only need one vaccination rather than two to get the full protection, which would be great. However, it's unlikely that that's really going to be something that we're really going to see people getting just one dose there, because we don't really have any good testing on that in terms of the trials. Also, exactly when that would, how recently someone would have had to have COVID, and the number of undiagnosed cases from last spring. We didn't have a testing apparatus, means we probably won't get to draw too much from this, but there's one thing to note there: if you are getting your vaccine and you've had COVID previously, you can probably expect to have some pretty heavy side effects that will be rather unpleasant, but you can feel comfortable in the knowledge that you are going to have much stronger results from those vaccines, much stronger protection than you would otherwise. In other news, 2 Massachusetts state reps tested positive for COVID in the last week, both of whom had received their vaccines. And this is just an important thing to bear in mind about what vaccination actually means. Representative Stephen Lynch had received both vaccine doses. I still tested positive, however, is asymptomatic. And remember, it is only 95% effective even after 2 doses. But it is also still possible that a person could acquire the virus, not have any symptoms, and still test positive, as the vaccine is giving them protection from sickness but not infection. This is something we've been talking about a bit. We don't know if a person will be transmissible still, be able to spread it to other people. But this is just sort of a good example there. The other one was Representative Lori Trahan, who had only gotten her first shot last week. It's also important to note that you really don't have full protection in the days after your first shot, or even the days after your second shot. It's 2 weeks after your second shot is when you reach that full 95%. And finally, some rougher news. B117 is still changing and mutating, and has in some areas acquired one of the same mutations that B1351 has that makes it stronger against the vaccine. This is something we do unfortunately have to expect as these vaccines continue to mutate and change, or these viruses continue to mutate and change. And this is why we're in such a sort of dead sprint here to get as much vaccine into people before these variants become really widespread. But we still have, all of these variants have appeared in the United States in various areas, but so far have not seemingly spread very far. Unfortunately, we don't do a lot of genetic testing here in the United States, so we don't really know exactly how far they're out there. But this is kind of what the race is. If the variants weren't out there where we are with vaccines, we'd be sitting pretty well right now. But now we just have to try to get as many people vaccinated as we can before the variants make it big. So speaking of the vaccines, the United States has administered 32.2 million vaccinations. That's 26 million people having received one or more vaccinations, and just under 6 million people have gotten both doses. This is out of just under 50 million vaccines sent out to the states. Here in Massachusetts, we have given about 600,000 vaccinations out of 1 million that we have received. We should expect a lot of these numbers, especially the Massachusetts ones, to ramp up very soon as we enter phase 2 here in the Commonwealth, which expands the pool of eligible people for vaccinations much wider. One final thought as we head out into our week. This is a chart showing the number of pediatric deaths from the flu over the last 3 years, excuse me. And each of these flu seasons, you can see in green there how many how many children have died from influenza, and you can see the 3 previous flu seasons, and then this last flu season, the total was 1. And this just goes to show how all of those distancing measures, the hygiene, the masks, hand washing, everything we've been doing there, how that has actually had some other positive effects as well, and cut down, there may be some other areas where other diseases are going untreated, but some communicable diseases like this have been significantly clamped down because of the measures we're taking against COVID-19. So a little bit of a silver lining there. And you can find our sources at the COVID Tracking Project for all those graphs. New York Times for the raw numbers there, mass.gov, Massachusetts specifically, and increasingly cdc.gov, which has recently stepped up its trackers, including the vaccine data. So those are all places you can go if you want to take a look at some of these numbers for yourself. And for more for the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.